Good afternoon, ma'am.
Good afternoon.
My name is Teshieka. I'm going to be your nurse today. Can you give me your name and date of birth, please?
Cedrica James, 52092.
Okay, Miss James. I'm going to just get a few questions and answers done from you, if you don't mind, and then I'm going to do a full body assessment on you. Okay?
Okay.
All right. Okay. So the first thing is, can you tell me the date?
August 11, 2015.
Okay. Can you tell me where you are located right now?
The hospital.
Okay. And can you tell me what the year is?
2015.
And who's the president of the United States?
President Barack Obama.
Okay. Awesome. So you're alert and oriented times 3. That tells me that you know what's going on and you know what's happening with you. Okay. All right. I'm just going to do a quick kind of outside assessment of your skin. I'm just going to look at you from head to toe. I'm not going to do anything quite yet. Okay.
Okay.
All right. So I'm going to make sure I go wash my hands first, and after I wash my hands, we'll get started. Okay.
Okay.
Okay. All right. Just looking at your skin color is appropriate for your race. You don't have any abnormalities that I can see on your skin at this time. Okay. I'm just checking your skin for its turgor right now, basically just trying to check your hydration status. And this tells me if you're able to maintain a certain level of drinking and keeping your fluids up, okay?
Okay.
All right. Then just walk behind you and look at your back as well. Okay. So I've looked at your skin, your full head to toe skin. I don't see any abnormalities, but I do see that you have a boot on this foot. Can you explain to me what happened to your foot?
Fractured toes and car accident.
Okay, so according to you and according to the chart, you have a fractured 4th and 5th toe. So I know that's going to limit you from doing some of the things that we need to do today, but we'll do our best to make sure that we discuss those things as we go along, okay?
Okay.
Okay. All right. What I need you to do is bring both legs around. I'm going to see you sit up in the best posture that you possibly can. Fantastic. Okay. I want you to lie back just for a second. I'm going to help you lie back. You can lift your feet as you lie back. Okay. And you can sit back up for me. Fantastic. Okay. All right. Fantastic. All right. I'm not going to have you do a whole lot of walking because I know that you're not able to completely walk, but I'm going to have you get down just to show me how you walk real quick, okay?
Okay.
And I'll grab your crutches for you. And I'm just going to have you walk about to right here and come back and you can sit back up. Thank you. I noticed that you have a unsteady gait, that you're doing a little bit of a jerking movement due to that foot being broken, those toes, but you are able to maintain your own weight on those crutches. You don't have any involuntary muscle movements or anything like that. Good job. Okay. All right. I want you to look directly at me. Okay. A couple things I want you to do. The first thing I want you to do is to follow my finger. I'm going to go right to left. I want you to follow it as I go. All right. You ready?
Yes.
Here we go. Awesome. Awesome. Good. I'm going to grab my pen right here. I want you to look straight ahead. Just going to do a quick look into your pupils. Good. Your pupils are equal, round, reactive to light, and accommodation. All right. I want you to hold your arm straight out for me. Press down for me. Good. Turn over. Push back. Good. All right. Bend both arms for me and bring them back down. Bring your arms out. Bring them back in. Awesome. Good job. Should I try to bend for me? Good. Now extend for me. Good. Same thing. Bend. Good. Extend. Good. All right. Let's do the same thing here with your legs. Stretch this leg out. I want you to stretch as far as you can. Bend up. Good. Be gentle with this one over here. Same thing. Bend up. Good. Okay. Just going to test your reflexes a little bit, and then we'll continue to go on from there, okay?
Okay.
All right. Good. Should have grabbed my fingers for me as tight as you can on both sides. Go around this way. Good. Push up for me. Good. And push up for me. Good. All right. Noticing that the inside of your hands are a little moist, but the rest of your skin is warm. It's intact. It's nice and dry. All right. I want you to shrug your shoulders for me. Good. Okay. Swallow. Good. Speak.
Hello, nurse.
Okay. Can you say ah?
Ah.
Good. I'm gonna do that one more time with my light. Normally I would use a lighted scope so that I can see. We're gonna use our pen light because that's what we have available to us, okay? So again, say ah.
Ah.
Good. Swallow and speak.
Hello, nurse.
Okay, fantastic. I checked your vital signs and your blood pressure. Your blood pressure was very good today. You were in the 120s over 80s range. Your temperature was within normal range and then right around 98.6. So that was good as well. Your pulse rate is good. Your respiration rates are good. So that means you're breathing in and out at a good rate. It's not too deep. It's not too shallow. You're breathing at a very normal rate, which means that you're doing pretty well so far, okay?
Okay.
All right, I'm going to listen to your heart and lungs next, okay?
Okay.
I'm going to listen to the front as well as the back, okay?
Okay.
Take nice deep breaths in and out for me. Good. Good. Okay. Put your hand down to the side for me. Again. And again. 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 And again. Awesome. I'll listen again to your heart. You breathe normally. Awesome. And we'll finish up with the rest of that in just a second. I'm just going to continue to look a little bit at your head and neck. And normally I would use an otoscope, and an otoscope gives me the opportunity to be able to look inside of your ears, to look at the inner structures of your ear. But right now I'm going to look at your ears just to see where we are, okay?
Okay.
So the outer portions of your ears seem to be intact. There's no visible abnormalities at this time. And like I said, I would be using an otoscope to look inside your ears. chin down this way for me. Just checking your hair and your scalp. You have a very pretty hairdo.
Thank you.
Okay, you can hold your head up for me. All right. I need you to smile for me. Good. Nice and symmetrical. You can take that smile back down. I want you to bring your chin to your chest and bring it back up. Take your head and turn this way. Good. Back to the middle and now this way. Awesome. Good job. Forgive me. I'm sorry. Okay. I'd like you to take your tongue and take it to the roof of your mouth, like so. Awesome. Okay. Now stick it all the way down as far as you can, all the way out. Wonderful. Okay. All right. Looks good so far. Okay. I'm going to have you scoot back on your chair a little bit on the bed, and we're going to do an assessment. I'm going to have you lie down. You're going to lie flat, and I'll assess you from there. Okay. I'm just going to bring this out just so you can be a little bit more comfortable. Okay.
Okay, thank you.
Okay. All righty. And normally I would check your breast at this time, going from an outward motion to an inward motion, just to see if there's any lumps, bruises, or anything like that, any tissue that looks any different or feels any different. I would also check up under your arms and do the same thing to check to see if we have any lumps or bruises or any type of abnormalities there as well, okay? All right. Right now I'm just gonna kind of do a palpation on your stomach and your abdomen, and I'm also gonna do a little bit of tapping. That's for me to listen to the sounds that your organs are making, okay? Okay. Let me know if you have any discomfort during this time.
Okay.
Okay? Now I'm going to go a little bit deeper this time, okay? I'm checking the margin, the borders of your organs. So right now I'm feeling the border of your liver. Also checking to see if your bladder is distended. And now because you're in a lying position, I'm going to listen to your bowel sounds, okay? And I'm going to listen to these for 1 full minute.
Okay.
Okay. Okay. You can sit back up now. You can get back to the edge. I'm just going to clean my hands. All right. I noticed your reflexes were good in all of your tendons and your upper and lower extremities. I'm going to just check your pulses real quick in all areas and work through all your pulses, okay?
Okay.
Your carotid pulses are good at a +2. Brachial pulses are at a +2. I'm going to lean you back just a little bit. Femoral pulses are +2. Popliteal pulses are at a +2. Your anterior tibial pulses are at a +2. I'm going to check the dorsalis pedis on your right foot and not the left foot due to your injury. Also at a +2. Good job. Okay. I'm gonna wash my hands. There was a couple things I didn't do. I'm gonna do real quick, but they're a little bit more uncomfortable, so I figured we'd do those last, okay?
Okay.
I want you to say ah. I'm gonna test your gag reflex just a little bit, okay? All right, ready? Say ah.
Ah.
Okay, good. That's why I wanted to do it a little bit later. It's a little bit uncomfortable. Okay. All right. I want you to let me know if you hear this vibration, okay?
Okay. Yes.
Okay.
Yes.
All right. Can you tell me about your pain right now? You have any pain?
No.
Okay. Good. All right. I want you to test your nostrils for me. I want you to press each side down and breathe in. I'm just going to look for your patency in your nostrils, okay?
Okay.
All right. You may begin. Okay. Okay. Notice your left nostril is a little less patent than the other one, which means you have a little bit more probably congestion on that left side than you do on the right. Okay?
Okay.
All right. All right. Your lung sound very clear. Your abdominal, your bowel sound very good as well. Your heart sounds good. I heard a S1 and a S2, which means that it's beating the way that it's supposed to be. You're able to move all of your extremities in real time and be able to move them in symmetry, which is good. You do have some conditions with this left foot. You're not able to put down as much weight as you normally would, and you're not able to flex it back and forth as you normally would, but it still works pretty good, and you were able to do so with the right foot. All of your reflexes are intact, which I found was good. You were able to swallow. You were able to turn your head the way that you need to turn your head. I found no signs of lymph nodes or any type of nodules that would alert us to thinking that we might need to do further testing. At this point, my recommendations for you are that you continue to follow up with your orthopedic doctor regarding the foot so that you can get that injury taken care of. Also, I did notice when I did your weight that we want to work towards getting you at a lower BMI, which is a body mass index. So I'll give you some education information on healthier diets and exercise and those things that will make you get you a little bit healthier. But otherwise, I think you're in great shape. You're very healthy. Your skin looks good, and you're doing great.
Thank you.
Thank you. I appreciate your time.
Thank you.
Okay, Miss James. We got a little cutoff in the middle of our video, but we wanted to make sure we added that. We do want to make sure we check your sinuses as well as your vision. Okay.
Okay.
So I'm going to have you just look straight. I'm going to do a little bit of pressing on your face. I want you to open your jaw for me. Okay, and you can close it back. Okay. There's a vision board right here, your Snellen chart, and I'd like you to just tell me those letters you see, the highest letters you can see.
A, B, C, D, and E.
Okay, awesome. That's correct. A, B, C, D, and E. So I'm going to say that you have 20/20 vision, which means that you are able to see. I again apologize that we got cut off in the middle of what we were doing, but I wanted to make sure we added that back. Again, I thank you for your time.
Thank you.